It's hard to beat some quality time with your son.
You can throw it a little bit harder at me.
For Sky Saslov, it's a welcome break.
Look at your target.
For the past several years, she struggled with debilitating depression.
I don't even know how to explain it because it's not angering, it's frustrating.
Saslov has what's known as treatment-resistant depression.
Sorry, interference.
She has major depressive disorder, which has been chronic, going on for over 7 years, and she has either failed to respond or failed to tolerate a number of antidepressant treatments.
So earlier this year, Saslov tried something different, agreeing to be part of a study at Sunnybrook Hospital in Toronto that uses a non-invasive approach to treating this kind of depression. With her head shaved and fitted with a metallic headgear, Saslov was placed in an MRI. Once inside, doctors then used ultrasound beams to heat and disrupt the precise part of the brain that causes depression.
It's going to get warm, okay, as we heat the tissue.
Think of it as an adjustment to the circuits of the brain.
And so the MRI guided focus ultrasound goes directly to that circuit, makes a cut or a lesion in that circuit, and stops it from firing when it shouldn't be firing.
The procedure is painstakingly slow, over 4 hours. And as Saslov is wheeled out, it's unclear if the treatment worked. It could be months before she feels any changes. In the meantime, doctors elsewhere are looking at other ways to treat the illness.
What you just heard was a very high-frequency magnetic pulse.
One of those is a brain stimulation treatment that uses magnets instead of electricity to induce a seizure.
Magnetic seizure therapy was really evolved out of this idea that producing a seizure for therapeutic purposes is very effective in depression.
One of the 250 patients who received the experimental treatment is Sharon Jacob.
I had incredible suicidal thoughts. I wanted to kill myself.
It got to the point her partner Karen had to suicide-proof their home.
Got rid of all the knives, all the scissors, anything sharp.
Oh, dark blue.
Jacob had a total of 30 sessions of MST, but she says she started feeling different early on in the treatment.
I felt what I call lighter because I felt less sad, less depressed, and eventually the suicidal thoughts diminished.
So I'm holding out hope.
Sky Saslov's progress hasn't been as successful. Her depression hangs on, but she's not ready to give up. Neither are her doctors, who've told her that it might take up to a year before she feels any signs of relief. Cass Rusi, CBC News, Toronto.